warahmatullahi wabarakatuh. I'm Nur Nadia Syahda binti Ramli. I had undergone my clinical training at Klinik Kesihatan Bandar Jengke. So this is my case study presentation. The first one is anemia management in pregnant women, and the second one is undernutrition in twin children. The first one is anemia management in pregnant women. This is the table of contents. So for anemia management in pregnant women, the patient's name is Mrs. Brooke. She is 29 years old and a Malay female. She lives in Bandar Jengke, Maran Pahang with her husband and their 4 children. This is her 5th pregnancy and she is currently in her 33rd weeks of pregnancy. She and her husband graduated from secondary school and they are self-employed. She is moderately active and easily tired due to heavyweight pregnancy. She has a family history of diabetes mellitus and hypertension. She had a history of group B Streptococcus aureus during her 4th pregnancy. For the case chronology, she had been referred to a nutritionist on 4th March 2021 for anemia management. So during this time, her gestational age is 25th weeks of pregnancy. Her HB level is 10.4 gram per dl, which indicate mild anemia. On 14 April 2021, she is meeting a nutritionist. During this time, her gestational age is 33rd weeks of pregnancy. Her HB level is 10.3 gram per dl, which indicate mild anemia. Her 24-hour diet record was taken and her total calorie intake is 2048 kilocalorie. Nutrition counseling was done and she had been advised to increase an intake of iron-rich foods from animal and plant sources. Consume iron supplementation with food sources high in vitamin C and do not take iron supplementation with foods that could hinder iron absorption such as caffeinated drinks and milk. Her TCA will be on 35th weeks of pregnancy to check on the HB level nearing 36 weeks of pregnancy. Her last HB level, which is 10.9 gram per dl, before she gave birth at 36 weeks of pregnancy. For medical diagnosis, anemia could occur when the quantity of red blood cells or the concentration of hemoglobin within them is lower than normal level. Hemoglobin level can be classified into 4 categories, such as severe anemia, moderate anemia, mild anemia, and normal. The symptom for anemia is fatigue, weakness, hair falling out easily, spoon-shaped nails, dizziness, and shortness of breath. The complication to the mother is miscarriage, bleeding during childbirth, susceptible to disease, poor heart function, and death. To the baby, stunted growth, low birth weight, premature birth, and death. So antenatal screening for anemia is very important to help prevent poor maternal and perinatal outcomes. Biochemical test that is used to test for anemia is full blood count test and hemoglobinometer. Hemoglobinometer will be used if full blood count test is not available. For diet diagnosis relation, anemia problem experienced by Mrs. Brooke is due to the lower consumption of foods rich in iron sources and the method she consumed, iron supplementation. Next is medication or drugs. In her early pregnancy, she had been prescribed a hematinic tablet once per day. It consists of ferrous fumarate, vitamin B complex, ascorbic acid, and folic acid. In her 60th weeks of pregnancy, her hematinic tablet had been increased into 2 times daily. In her 25th weeks of pregnancy, she had been prescribed a Matoffer tablet. She 71, which indicate hypotension. In this graph, we can see that Mrs. Brooke have a normal HB in the first trimester, but in the second trimester, her HB dropped to 10.3 gram per dl, which indicate mild anemia. This is her 24-hour diet recall during her first nutrition counseling. So the table above shows that Mrs. Brooks' 24-hour diet recall taken in fasting month. According to the diet recall, she has a total calorie intake of 2048 kcal with 263.4 gram carbo, 72.8 gram protein and 75.7 gram fat. So we can conclude that she has a lower consumption of iron-rich foods in diet, and it could lead to decreasing in hemoglobin level even though she consumes iron supplementation every day. For the nutrition diagnosis and intervention, for nutrition diagnosis, inadequate iron intake related to low consumption of iron-rich foods and poor iron absorption in body as evidenced by hemoglobin levels of 10.3 gram per dl, which indicate mild anemia. For the objective, the first one is to increase HB level to 11 gram per dl before 36 weeks of pregnancy. As for the principle, to recommend on pinggan sihat, to suggest having 3 times of main meals with 3 snacking time in between main meals, to encourage consumption of iron-rich foods such as chicken, liver, fish, meat, green leafy vegetables and nuts. Next is to ensure increased intake of fruits and vegetables rich in fiber and iron in every meal and snacking time. And lastly is to increase consumption of 6 to 8 glass plain water every day. For the second objective is to correct the way of taking iron supplementation. For the principle, it is suggested to consume iron supplement with high vitamin C drinks such as lime or lemon juice. And number 2 is to avoid taking iron supplement with foods or drinks that can hinder iron absorption such as milk, coffee and tea. For estimated energy requirement, the range of energy requirement for Mrs. Brooke is 1007 and 2340 kcal per day. Thus, energy requirement chosen for Mrs. Brooke is 2021 kcal per day, which is the recommended energy requirement. So this is the estimated macronutrient distribution. For carbohydrate, it is 60% from estimated energy requirement, protein 15% from estimated energy requirement, and fat 25% from estimated energy requirement. This is the menu planning. So this is the menu suggestion for weekend, weekday 1 and weekday 2. For monitoring and evaluation, for anthropometry, she should self-weigh every week to keep track on her weight and avoid excessive weight gain from the recommendation weight gain. For the biochemical, Mrs. Brooke will have her HB level checked in her next follow-up, which is 38th April 2021 on her 35th week of pregnancy. If her HB level did not increase to 11 gram per dl, she will be referred back to BST. For the discussion, according to WHO survey, 38% of pregnant women in Malaysia was diagnosed with iron deficiency anemia during pregnancy. So anemia deficiency occurs during pregnancy is because of higher iron requirement for both mother and the baby in womb, where the baby needs extra iron for growing. So Mrs. Brooke was diagnosed with iron deficiency anemia with hemoglobin levels of 10.3 gram per dl, which indicate mild anemia. So the main concern for this patient is low intake of iron-rich foods and the method of consuming iron supplementation. So close-spaced pregnancy also lead to IDA. In Mrs. Brooke's case, she had no family planning and a poor spacing of pregnancy of less than 2 years. So these are the recommendations for Mrs. Brooke during nutrition consultation. The first one is to include iron-rich foods in her daily intake. For example, cows and chicken liver. Number 2 is she should also vary her protein intake and not only focus on animal sources. The third one is to recommendation on pinggan sihat, which are quarter carbo, quarter protein and half vegetables. The fourth one is to consume iron supplementation with beverages high in vitamin C such as lemon and lime juice. conclusion, insufficient iron-rich foods intake could lead to iron deficiency anemia in Mrs. Brooke. The nutritional counselling and intervention are mostly to increase consumption of foods rich in iron to increase her HP level to normal level during 36 weeks of pregnancy. So her latest HP level is 10.9 gram per DL. It is before labour. The attending nurses also informed that Mrs. Brooke's baby did not have any complication during the labouring process, and the baby is term with a normal birth weight of 3.02 kg. The 24-hour diet recall of Mrs. Brooke using NutriPro. Next is undernutrition in twin children. This is the table of contents. For the introduction, twin 1 and twin 2 is an 11-month-old Malay female baby. They live in Kampung Baru, Jara Maran with their parents, older brother, grandparents, uncle and auntie. Their parents are graduated from secondary school, so the twin is moderately active with a history of bronchopneumonia. For the case chronology, they have been referred to a nutritionist on 15 February 2021 for weight gain diet and nutrition counselling or education for the mother. During this time, the twin age is 9 months old. Their weight and BMI for twin 1 is 5.4 kg with a BMI of 11.7, and for twin 2 her weight is 5.6 kg with a BMI of 11.6. 8 April 2021 they meet a nutritionist, so their age is 11 months old with a weight and BMI of 6.0 kg, BMI 12.2 for twin 1 and 6.4 kg with a BMI of 12.9 for twin 2. So their 24-hour diet recall was taken, and they had a total calorie intake of 874 kcal. Nutrition counselling had been done, and their mother had been advised to increase the energy intake according to recommendation energy for age, and to increase protein intake in their daily intake, and to increase frequency of formula milk intake. Next TCA on 6 May 2021. So during this TCA, their weight had increased from negative 3 SD to negative 2 SD. However, their BMI is still in negative 3 SD. Their total calorie intake increased to 1,105 kcal based on 24-hour diet recall. For medical diagnosis, malnutrition refers to energy and or nutrition deficit, which is undernutrition, excesses, overnutrition, or imbalances in a person's daily intake. So undernutrition includes underweight, which is low weight for age, stunting, low height for age, and wasted, low weight for height. For the diet diagnosis relation, so underweight problem faces by the twin is due to inadequate calorie intake, which is 874 kcal per day as recommended for their age, 900 kcal per day. So their inadequate calorie intake might be from low energy dense food, inadequate fat intake, or inadequate serving intake. Next is nutritional assessment and intervention. For anthropometry assessment, we can see that on the 11 months of age, the twin had a weight of 6 for the twin 1 and twin 2, 6.4 kg, which indicates severe underweight in negative 3 SD. Their height is normal, and their BMI is 12.2 and 12.9, which indicate wasted in negative 3 SD. So this is the graph of their BMI. This is the dietary assessment. The total energy intake is 874. So the table above show the twins' 24-hour diet recall taken in their first visit. So according to the diet recall, they has a total calorie intake of 874 kcal with 111.7 gram carbo, 36.1 gram protein, and 31.5 gram fat. So their daily energy intake can be considered as not having an inadequate energy intake. So low daily energy intake could result in severe underweight in children. So for nutrition diagnosis and intervention, nutrition diagnosis, inadequate energy intake related to low consumption of carbohydrate, protein and fats as evident by severe weight for age, -3 ft, and severe weight for height at -3 ft as evidenced by lower energy intake than recommended energy intake. So for the goal, the first one is to ensure adequate energy, protein and fat intake to promote optimal growth. For the principle, the first one is to ensure adequate daily energy intake according to the recommendation. Second one is to ensure adequate protein intake of 1.2 gram per kg body weight and varied protein sources. Next is to encourage intake of foods high in fats to promote weight gain. Number 4 is to encourage intake of 3 main meals and 3 healthy snacks a day. And lastly is to avoid unhealthy snack and caffeinated drinks that could hinder nutrient absorption. The next objective is to increase the serving intake. For the principle is to ensure follow serving size recommended for each person. And the last objective is to promote hygiene of milk preparation. It is to educate the mother on proper way of preparing milk and hygiene care. So this is the estimated energy requirement. It has been calculated using Dorothy for 6 children. The range of energy requirement for twin 1 and twin 2 is 1,131 to 1,305 kcal per day. Thus, the energy requirement that is chosen for twin 1 and twin 2 is 1,200 kcal per day. So this is the estimated macronutrient distribution. For carbo, 55% from estimated energy requirement. For protein, 15% from estimated energy requirement. And for fat, 30% from estimated energy requirement. So this is the menu suggestion for weekend. This is for weekday 1 and this is for weekday 2. So for nutrition monitoring and evaluation, for the anthropometry, weight and height monitoring will be done twice per month as they were in a severe underweight category. So their height and weight will be recorded by attending nurses at Clinic Desa Kuala Sentul. So further monitoring is needed to prevent the twins' weight from dropping or stagnant. For dietary, 24-hour diet recall is being assessed through phone calls on 6 May 2021. For anthropometry assessment, that is taken on 6 May 2021 by attended nurse. Their current age is 12 months old. So we can see that the weight for twin is 6.5 kg for twin 1 and twin 2 is 6.6 kg, which indicates they have a moderate underweight, which is -2 SD range. However, their BMI, which is 12.5 for twin 1 and 12.7 for twin 2, is still in severely wasted stage. So this is the dietary assessment. We can see that their total calorie intake per day increased to 1,105. So the twins anthropometry measurement showed an improvement in body weight from severely underweight in -3 SD to moderately underweight in -2 SD. Their height is still in the normal range. Even though the twins showed an increased weight progression, their BMI remained unchanged and still in the wasted state. So the twins actually had been registered under Food Basket program on 30th April 2021 and received a Similac NeoSure formula milk. So based on the 24-hour diet recall, the twin consistently consume 8 times per day Similac NeoSure formula milk. So their calorie intake increased to 1,105 kcal per day. However, the twins still consume half bowl of chicken porridge instead of 1 bowl. As for the discussion, So the twin was diagnosed with severely underweight with history of bronchopneumonia. So the main concern for the twin is inadequate calorie intake per day. So adequate calorie intake, which is 900 kcal per day, is very important for the twins' growth and development. An additional of 300 kcal per day are recommended to catch up their growth. So the total calorie intake that should be taken by the twin is 1200 kcal per day. So energy requirement of 1080.5 kcal per day or 696 kcal per day from milk and 384.5 kcal per day from foods was advised to the mother to be given to the twin. So the twin was qualified to participate in food basket program and had received similar usual on 30th April 2021. So the total energy provided by the formula milk is 90 kcal per serving. So on the next TCA, which is in 6 May 2021, an increase in weight from negative 3 ST to negative 2 ST was observed. So based on the 24-hour diary record, the twins' total calorie intake increased to 1,105 kcal per day, but however, their BMI still in wasted state, which is negative 3 ST. So a few recommendations are given to the mother to increase their twins' weight to catch up with their growth. The first one is to increase protein intake to 1.4 gram per kg body weight, approximately 10 gram per day of protein. So the mother need to vary the intake of protein from plant and animal sources. And additional of 1 teaspoon of oil into the porridge. And the last one is to avoid unhealthy snacking and caffeinated drinks, as this food could hinder nutrient absorption. For the conclusion, both of the twins gained their weight, but it is still in moderately underweight category. The twin is still wasted. The twin is still wasted state due to inappropriate weight and heart balance, which caused their BMI to be wasted. So underweight during infancy could affect growth development and lead to various health problems in later stages. So nutritional problems among infants and children need to be taken care seriously in order to reduce the prevalence of morbidity and mortality among children. So the parents also play an important role in monitoring their children intake. So this is the length for age for the twins. It is in a normal state. This is their 24-hour diet record using NutriPro. This is the reference that has been used, and thank you.